lot of cultivating, and I can't even imagine myself being pulled off of a tractor if my brother's colostrum and fresh milk was given to our neighbor. So I was really started with, what are the words of the law? And I break down my work into state, national, and international issues just to make it more simple for myself to understand. I'll start today with state activism, the areas that we work with. The areas that is most prominent for our organization to get calls from is when a person gets shut down for practicing medicine without a license. Because you know the doctor knows best, and they're the only ones that know what's really going on. So, here is the practice of medicine prohibition in Illinois. No person shall practice medicine or any branches or treat human ailments without the use of drugs and without operative surgery. That is the law of Illinois. So where does that leave everybody else? Here's the law of Washington. Anybody who offers or undertakes to diagnose, cure, advise, or prescribe for any human disease, ailment, injury, infirmity, deformity, pain, or other condition, physical or mental, real or imaginary, I thought that was cute, by any means or instrumentalities. That is the practice of medicine. Now, we want our doctors to be able to help people in the broadest sense. But when you put a criminal violation onto this definition saying, if you don't have a medical license, you are a criminal. So there's a list when these started of exemptions, like, oh, we really didn't mean Christian Scientists, or, oh, we really didn't mean licensed nurses. The nurses went and got their own license so that they could be out from under this broad definition, criminally charged. Here's Kansas. They say, recognizing that the practice of healing arts is a privilege granted by legislative authority and not a natural right of individuals. That is not true, and our organization will fight that to get that out of our system in America whenever we can. These laws are extremely broad, and we have to have proper exemptions, meaning that we did not want the government to take jurisdiction over all of the people in our country. So we have, people getting shut down all the time. Washington homeopaths, electrodermal screeners, nutritional consultants, colon hydrotherapists. These are some of the latest investigations for nutritional consultants and colon hydrotherapy. These people have long businesses. They have websites. They do great work. There's never a complaint from a consumer. It's just based on what the law says. So another area is when a doctor gets really expanded and wise in what they use, they can be shut down for going outside of the conventional standard of care. So then you have doctors that are losing their whole businesses and sometimes getting criminal charges. So here's the definition of medical doctors, what they could be shut down for. Unprofessional conduct shall include any departure from or the failure to conform to the minimal standards of acceptable and prevailing medical practice, in which proceeding actual injury to a patient need not be established. That's just, they have to do what they're taught. They can't go outside the norm. Do you ever notice that when if you had a friend that had cancer, or if you had cancer and you go to a doctor and the doctor says, well, you have surgery, chemo, radiation, the end of story, and you're saying, well, does it affect my immune system? I mean, should I change my diet? Oh, no, diet doesn't matter. Well, should I go to an alternative? No, you can't do that. Well, if they said anything different, guess what? This is the law that they practice under. They can't say anything different unless they're in now one of the 27 states who have an exemption. About the forced chemotherapy for children, what is the law? Withholding of medically indicated treatment. Then you go back to the doctor. What did the doctor say? Well, what was the doctor able to say? So you've got a child protection hearing, you've got a medical doctor on the stand, and he's saying, what are you recommending? And he says chemo, radiation, and therapy. If he said anything different in that court, he'd probably lose his license. So there goes the child. So the raw milk raiders, state mandates pasteurization of milk. and you can't go across state lines either. So we're fighting this in Minnesota. We have 2 bills up to protect the private contract of a person to get raw milk from a farmer, and they can decide where it's delivered without food regulations. So some of the victories that we've had, there's new laws for traditional and unlicensed practices in 8 states now. They've been terrible fights, but we've made it through. Here's what Minnesota started out with. These words have never been in the United States law. Acupressure, aromatherapy, Ayurveda, cranial sacral therapy, there's the Gerson therapy and colostrum therapy. These are all protected under the exemption safe harbor statute. As long as you give out your prohibited, as long as you avoid prohibited conduct, and as long as you give out your disclosure saying you're not licensed, you're good to go. Can't puncture the skin, give out medications. Here's California's law that we passed in 2001 with their group out here, and they put a sentence in. Restricting access to those services due to technical violations of the Medical Practice Act is not warranted. These are laws that are drafted by citizens, by little people in their kitchens over coffee or tea. Louisiana has a similar exemption. Here's our latest one. New Mexico has a great safe harbor exemption for many, many of the unlicensed therapies, as long as you stay away from the prohibited acts in the statute and you give out your disclosure. So this is really taking on the jurisdiction issues for the medical domination. The state of Nevada, there was a dietitian bill there that was trying to say no one else could talk about nutrition unless you're a licensed dietitian. And we got this amendment in to protect the unlicensed regular persons. A person who furnishes nutrition information, provides recommendations or advice concerning nutrition. While performing acts described in this paragraph, they shall not be deemed to be in violation of that law. So, here are some of the states that have safe harbor exemptions for the unlicensed practice of medicine. Here's some states that have introduced bills. The ones in red are still moving forward. Here's my own handmade map of, if you're green, you have a freedom state. If you're blue, you've had a bill put in. And this is how I keep track of all the calls that we're getting around the country to make these laws happen. These are hotspots for 2013. There are things that we're working on. I'll show you. This is the list of hotspots right here. So these are, okay, we're a nonprofit. We have 2 full-time staff attorneys. We appreciate all the donations. We live on donations. And what we try and do is we have a software program that screens all the bills in the United States. There's thousands and thousands. So we put in search engines and we search for the bills that we think are interesting. If we get calls from a state, we work with a state group. Right now we are tracking 500 bills out of the 3,000 that we looked at, and we're working with 50 different groups. But these are the ones that are where we have a group. We maybe have a weekly call with that group. We're really involved in the drafting. We help people draft. If they're uncomfortable drafting, we review their drafts. We look at what they're trying to put into law. And then sometimes we go and testify at hearings, or we help them prepare their testimony so that they can convince the legislators when they're in the halls of the Capitol. What happens with some of the licensing laws, say that a naturopathic physician group wants to get a licensing law, and they make a very broad definition of the scope of natural healing, and then they say, and you have to have a license as a naturopathic physician going to these particular schools, or you can't practice natural health. So we go in there and we either delete that bill, or we amend it so that it covers and protects the unlicensed people that don't go to those particular schools. Because we think that all Americans should have the freedom of speech to do natural health in any of its forms, as long as they're not being dangerous.
And is that going on in
California has a safe harbor bill. They also have a naturopathic physician bill with an exemption in for traditional naturopaths and everyone else. So they have a good system in that regard. They have good exemptions. Although they did have, I believe, a dietitian fight that I can't speak to right now because I don't have it in front of me, but we can talk about that. So, and then the licensed professions, 27 states went forward and got changes to their laws. The first one was Washington, and they just put the word, the use of non-traditional treatments does not constitute losing your license. So that was how it started, and then more states started to go forward. So that's some of the state issues. I'm going to start now with a few of the federal issues because the federal government regulates commerce, products going across state lines. The states regulate occupations. So commerce, here's the definition of drug. An article intended for the use in the diagnosis, cure, mitigation, treatment, or prevention of disease in man or other animals. Now, doesn't that sound like the practice of medicine definition that we saw in the state level? So not only do they have jurisdiction over all the speech for occupations, they have jurisdiction over all the substances used for cure. So the big push that Clinton Miller was so involved in was to get an exemption in this paragraph. Articles intended to affect the structure or function used to also be drugs. But you see those three words, other than food. That three words took almost a revolution in the United States. Other than food. We protected food from the definition of drug as long as it was used for structure function. But if you use food for diagnosis, cure, prevent a disease, it becomes a drug. By law, it becomes a drug. This is a very big battleground. So this is what a dietary supplement is. It's a food in the United States. And these are the words that we put in. Vitamins, minerals, herbs or other botanicals. I mean, regular people just put these words into law and decided what they wanted. They're generally regarded as safe. And we just grandfathered everybody in that was marketed before 1994 to be protected by that Dietary Supplement Act. But now they're changing and they're challenging the things that have been from 1994 to now. They're trying to put massive regulations on them. So we're working, I'm just going to move through this a little bit. We're working with a bill that hasn't been reintroduced yet, but this is last year's bill. We're changing just the word from 1994. We're changing the statute to say 2007 to see what happens. I mean, you know, it could be that simple. Why not? Why not just grandfather and everybody else? Because they're vitamins, they're foods, for Pete's sakes. Why can't we just do that? So as a country, we need to do things like this, as a people. And if we don't, they just keep on taking over. So here's some of the federal bills that had to do with dietary supplements in the last 2 years. And right now, the bills aren't all introduced yet for 2013. So if certainly we can talk about these some other time, but I just wanted you to know we track anything that has to do with dietary supplements and what their impact is. So we oppose one, we support one, you know, and I'm not going to go into detail about them, but if you want to know about these bills, you can call our office and we will explain them to you. One of the bills that I thought was really important is the testimonial bill from Congressman Paul last year, because he said that you could actually say that something helped you and not get into trouble. And I think, well, how did it come to pass that we couldn't even put on our website or tell our clients that they got help, that they got cured? Why can't you use testimony?